Hello, my name is Dr. Rick Peterson with a group called the Doctor Speakers Network. Hello to all of you out there. This is a webinar that was organized to talk about the gut and the brain connection. And I'm very pleased to be here. Just so you know my background, I'm a certified functional medicine practitioner. I'm a certified clinical nutritionist. I'm a doctor of chiropractic, and I actually work in a clinic that is called Root Cause Medical Clinic. I helped founded a clinic that is oriented to getting to the root cause of why people have their problems. And we'll talk a little bit more about that. But basically, the Doctor Speakers Network basically works with a group of doctors that comes out in their area and speaks on their areas of expertise. This area we're going to talk about, which is how what you eat and what goes on in your digestive tract affects your brain, is a really important thing to understand. I'm going to switch to some slides here in just a minute, which you'll be able to follow along very well with the message. But basically, the purpose of Doctor Speakers Network is to try to help people stay as healthy as they possibly can so they can continue to work effectively and have their bodies work the way they're supposed to. In the end, you shouldn't, in the area of gut and brain, okay? I work with it every day. People are amazed at what it is that causes them to have brain fog. If you are concerned about trying to understand why you are prone to anxiety, okay, and prone to depression, or prone to brain fog or memory problems or anything like that, that's what we're going to talk about. I have a little different perspective on helping people with anxiety. Our clinic, we have a lot of people come to us that have already been on lots of medications perhaps and want to have a different alternative. And we kind of look to the root cause of it. And part of what I'm going to show you today is that anxiety, depression, brain fog, memory problems, all those things you think about the brain, that many of those are related to changes in your health. And even though anxiety is prevalent, that what I'm realizing is that it's very much a symptom. I have a lot of people come to me, they say, I have a pretty good life. I got a job I like, I got a great family, everything is good in my life. I'm just depressed or I'm just anxious. If that is you, you have come to the right webinar, because hopefully by the time we're done, I'll give you a little bit of an idea of what that's all about. Because in the end, I'm going to show you that brain problems are another symptom that occurs. Okay, so in other words, anxiety is another symptom, as opposed to you have a horrible life. It's a symptom of your body not working properly. And that's really kind of what this lecture is about today. So let me bring up the slides and we will take it from there, all right? So, okay, so today's lecture is on the gut and brain. And there's me. I'm a certified clinical nutritionist. I'm a doctor of chiropractic. Gives a little bit of background. I co-authored a book called The Gluten Effect, which is a book that explains how gluten can affect your body and affect your brain, okay? So we're going to talk about the top 5 ways your digestive health affects your brain function. And we're going to start looking at how your digestion, as it malfunctions, how it affects your brain. We're going to talk about food reactions. Have you ever eaten a meal and you get done with it and you're like, you just don't have clear thinking, or you try to go back to work and you fall asleep or something like that? There's a specific reason why that's going on. And we're going to go over that. Then we're going to get into some digestive symptoms themselves, help you better understand what's behind things like acid reflux and something called hiatal hernia, why people have issues with bloating and that type of thing. And I'm quite sure we'll give you a different perspective on how to go about looking at this, okay? Now, it doesn't matter whether we're talking about brain issues or whether we're talking about energy or hormone issues or whatever, I always like presenting this from the concept of why does a person have a problem? So you have to realize that the symptom that you have, so if you're concerned about migraine headaches or you're concerned about brain fog or anxiety, that's the symptom. That's the thing that's occurring because of what's wrong with you. And that means that something in your body has had to go out of balance, had to malfunction long enough for you to develop that symptom. So the symptom is like the red light on your dashboard. Driving down the freeway, got lots of red lights going on your dashboard. That tells you something's wrong with your car. In today's society, what people do is in relative to health, they pull off to the side, loosen the light bulbs. So they pull off, they go to the doctor, get something to take their headache away, get a medication to take away their anxiety, get a medication to help them sleep. But that's like loosening up the light bulbs on your car. You're not changing what's wrong with the engine or what's wrong with the car. You're just making it so you're no longer annoyed by the red light that's flashing on your dashboard. So that's one of the things we're going to talk about, and that's really what's behind what I'm going to discuss today, is to give you a different perspective. We're trying to help you become proactive about your health. You see that approach I just talked about, which is like treat the red lights, okay, not really treating what's wrong with you. That's a reactive approach, and meaning that, that's mostly what we have in our healthcare system is once you're sick or once you need a doctor, you go to the hospital or to the ER, or you go to your local doctor to help with the symptom that you have, right? And that's the bulk of what you're going to get. What I'm going to talk about today, and what I do day in and day out, is I help people start sorting out what did you do in the past, and what are you still doing today to your body that is overwhelming it so much that it can't perform properly, okay? Because if you can handle that, it would be just like if you're scratching your skin every single day for a month, okay? Your skin would look pretty bad, but if after a month you just stop scratching it, it's going to go back to normal. So identifying what are the factors that are causing you to have problems is critical. That's what we call lifestyle stressors, okay? So we're going to actually look at some of these lifestyle stressors as it relates to the gut. And so let's talk about the next thing. Okay, hold on. There we go. So do you have any of these symptoms? Gas, bloating, acid reflux, reflux disease, constipation, diarrhea. These are all symptoms that shouldn't be there, okay? The simplicity is that when you have IBS or Crohn's or even ulcerative colitis or diverticulitis, you're simply not digesting your foods properly. So in other words, that's kind of a given, okay? But your digestion isn't performing properly. What we have to figure out is why. Here's the important thing to know. Your body does not spontaneously just get worse, okay? Your body does not spontaneously one day be normal and the next day it's abnormal. It has to be driven there, okay? So it's like if you go to bed at night with your skin normal and you wake up in the morning, it's not going to be bleeding unless you've done something to the skin. So unless you've done something that's overwhelming your digestive tract, you're not going to have these symptoms. So just teach you a little bit of anatomy. The gut is commonly called the second brain. There's several reasons for that, which we'll explain as we go along. But essentially, you've got, food comes in through the mouth. You chew it. You begin to get saliva, which starts intermixing with the food that already begins to digest your foods. It's swallowed through the esophagus. The esophagus goes down and dumps into your stomach, which is essentially a acid-filled organ. And the diaphragm it talks about here, it's like for your food to get down your esophagus into your stomach, it has to penetrate the diaphragm. So there's a hole in your diaphragm called a hiatus that allows food to get through. Then once the food moves out of the stomach, you go into the small intestine. That's 23 feet long. Your small intestine is where you absorb almost all of your food. In fact, the villi, the surface area where all this food gets absorbed is the size of a tennis court. Okay, so if you flattened out the inside of your small intestine, the surface area is the size of a tennis court, and it's needed that much because you have to absorb all your nutrients through those tissues. Okay. Now, just so you know, which is going to be an important part for you to understand relative to brain function, because brain function is affected by the immune system. That whole tennis court requires that there are guards at the door to prevent things from coming in. Those guards at the door are immune cells. That is the reason why 70 to 80% of all the immune cells in your entire body are physically located in your digestive tract. Now, that's huge because you should know that 100% of your immune cells throughout your body communicate with one another, but 70 to 80% of them are located in the digestive tract. Therefore, your digestive tract is the portal of entry into your immune system. Now, why is that important? I will come back to this, hiatal hernia. Well, let me just talk about why is that important is that you have to understand what it is, the anatomy. Now, I throw this, we actually just inserted this in because it's something we deal with almost a daily basis, and it's so severely underdiagnosed. So people who have unknown panic, they have panic attacks, they don't know what it comes from. They get increased heart rate, they get increased pressure in the chest, they get pain in the abdomen, they can't swallow foods very well, they get heartburn. This is all because the stomach moves up into the diaphragm, and the diaphragm gets into a spasm. That's what's called a hiatal hernia. So the stomach moves up or herniates through the diaphragm. The diaphragm goes into spasm. It no longer moves properly. It's difficult for you to get a breath. You can't get a deep breath up and down because the diaphragm doesn't move properly. So it's very common that people will get shortness of breath. They will feel panicky because they're not getting breathing done properly. All of those things are related to what's called a hiatal hernia. Now, I'm mostly talking about hiatal hernia from like what are the symptoms of it, but in essence, you have to have enough pressure from below to push the stomach up into the diaphragm, and that's part of what we're going to talk about with the rest of this. Okay. So there's something that a lot of people have heard of. It's talked about here and there, which is a concept called leaky gut. Now, leaky gut means that tennis court is designed to be able to only let a certain size molecule penetrate out of your digestive tract into your bloodstream. Okay, so in other words, when you're digesting foods, it gets broken down into smaller and smaller pieces, and eventually the molecule is small enough that it can penetrate into your bloodstream. When you have a leaky gut, the size of the molecule, so your gut becomes more permeable, the size of the molecule that can get out of your digestive tract into your bloodstream is much higher. So in other words, you can have undigested food particles, bacteria, various things that should never be penetrating your intestinal tract into your bloodstream are with a leaky gut that's capable of happening. Okay. A leaky gut occurs because of chronic damage being done to the small intestine. I have a big question why here. I could do an entire lecture just on that, but what I can tell you is that it's the standard American diet. It is having too many chemicals in our diet, having too much processed foods in our diet, having too much sugar in our diet. These are the types of things that begin to create damage. At the beginning of my lecture, I showed you I wrote a book on gluten sensitivity. If you are gluten sensitive and you are eating gluten, you will have a leaky gut because it creates that kind of damage. It like punches holes in your intestinal tract. If you eat a food that you're allergic to, Today, you will have a leaky gut, okay? As it says here, medications and like for instance, certain types of medications will increase a leaky gut. Like for instance, antacids to relieve your stomach acid pains will increase a leaky gut. Toxic exposures will give you a leaky gut. Okay, so basically things begin penetrating through. Now, part of what the problem with that is that 70% of your immune cells, you have immune cells standing guard at that membrane level to basically prevent dangerous things from coming into your digestive tract or out of your digestive tract into your bloodstream. When you have chronic leaky gut, you will have heightened immune activity. That heightened immune activity is what causes inflammation. So the number one thing that occurs with the leaky gut is that you will have heightened levels of inflammation because these cells at the level of your digestive tract release inflammatory chemicals as a way to protect, okay? Now, so in other words, you got foods trying to pass this membrane. Right on the other side of this membrane are your immune cells. And the way they will protect this onslaught is they will release inflammatory chemicals into that whole site in your digestive tract. Now, these inflammatory chemicals not only can cause digestive upset, okay, but these inflammatory chemicals get absorbed into your bloodstream and affect the brain. So now I'm going to give you, I will come back and repeat that, but let me give you an example. Research in this has been established a long time ago. In fact, I've been doing clinical nutrition for over 30 years. Probably 25 years ago, there were a whole series of studies done with hyperactive children, okay? And they just very simply did the study where they would basically evaluate their behaviors, their mental activities prior to the study, and then they divided them into two groups where they kept one on a standard American diet. The other group did two things. They eliminated two of the most common food allergies in America, which are gluten and dairy. So they did that for 1 month. After 1 month, they brought them all back in and they evaluated them. 70% of the children that had been on the gluten-free, dairy-free diet had significant, if not complete, reversal of their symptoms. They were no longer bouncing off the walls, in other words, right? Their behaviors were dramatically better as reported by their parents, right? So how does this happen? And by the way, this has been known for a long time. Some of you are parents out there, you know if your kids get into too much sugar or get into things that they will bounce off the walls, because what happens is that food comes into the digestive tract, it stimulates massive amount of inflammatory chemical release. Those inflammatory chemicals are what affect the brain, okay? And so research a long time ago established that it's the inflammation in the brain that gets created by these foods that affects the brain's ability to function normally. So it's the foods that essentially cause the brain inflammation. In the case of those children, we're talking about, dairy and gluten, but in this, what's called hyperactivity in children can be called anxiety in adults, okay? So anything that's going to agitate the way your brain normally works will occur from these food intakes. Now, the other thing that you should know is that this is interesting because your brain also has a lot of immune cells in it, and it's where inflammation can occur. When I went to school, this is over 25 years ago, there's a group of cells in the brain that were called glial cells. I essentially learned that they were connective tissue. In other words, they were like supportive tissues in the brain. Makes up about 60% of the brain, okay? Today, it's realized that those are immune cells that are capable of creating inflammatory reactions. The whole psychiatric industry changed about 5 years ago, about 2015 or so. It was that there were a whole number of studies done, have been confirmed many times since, where they actually did PET scans of people's brains who had, PET scan is like a type of imaging. It's sort of like an MRI, but it's a little bit different. And it is, they basically tested people that had anxiety, depression, ADD, brain or memory problems, dyslexia, anything related to brain function. And they found that what was consistent is they had physical inflammation in the brain, okay? So what you eat comes in through your gut, stimulates inflammatory reactions, and that inflammation is carried forward into the brain. So there are known inflammatory and anti-inflammatory foods, and here's a list of them, okay? What I can just tell you is the standard American diet, the SAD diet, standard American diet, is really what's behind quite a bit of this. In the upper right, carbohydrate and simple complex, I would say number one in that is sugars. Eating processed sugar is definitely causing leaky gut and creates inflammatory reactions. There are whole diets out there called anti-inflammatory diets. We work with them all the time, how to get people onto a diet that's less inflammatory. Fats, omega-3s versus omega-6. The majority of our American diet is omega-6, which are, those are inflammatory oils. So the oils that are in fried foods, hydrogenated foods, anything that's heavily cooked or processed are omega-6 oils. Omega-3 oils are like fish oils. Maybe you've heard those being good for you. Animal versus plant. Animal products themselves are inflammatory, actually for a couple of reasons. One is because of the way there is specifics. IGF is a insulin growth factor. Anyway, it basically is very involved with inflammation. Heme iron, which is found in meat. So a lot of people think, okay, well, if I eat meat, I'm getting iron. Well, you're getting a form of iron called heme iron, and heme iron in the end is a type of iron that causes inflammation. So somebody who's on a heavy meat diet can have increased levels of inflammation. And then processed meats. So a lot of the processed meats like bologna and salami and all those types of processed meats, they're considered carcinogenic, first of all, but they're highly inflammatory. So you can sort of see these are just a few of the foods that affect things. Now, the Human Genome Project, which mapped out all the genes in the body, discovered that there were about 20,000 different separate genes in humans, which the number of genes in humans doesn't really make a difference because, just to give you a sense, an earthworm has 90,000 different genes, okay? So the difference between what's going on with just genetics and what makes what we do is that we also have the genetics of the 39 trillion bacteria called our microbiome that is also affecting the way our body operates. There's more bacteria in the lining of your digestive tract than there are cells of your body. There's a dramatic, there is a strong purpose for those probiotics. By the way, they're called healthy bacteria or probiotics, and lack of those probiotics are part of what keep you from having a leaky gut, or lack of those probiotics give you a leaky gut. Okay. Happy microbiome means a healthy body, and so this gives you a general sense of the types of things that are important. The one thing I want to start showing you are things like artificial sweeteners and how those begin to create problems. There's a 10-year study that showed more than one soft drink per day increased dementia by 2.5 times in adults. You have a 3 times increased risk of Alzheimer's, a 3 times risk of stroke when you have exposure to these chemicals. And these are part of everybody's day-to-day diet, okay? Diet and attention to children. I sort of made reference to this, but you need to know that there's an epidemic going on in our society, and that is in the area of how children and their brains are being affected. And I sort of gave you the background of this with what I've talked about up to this time, but there's 6.5 million American children diagnosed with ADHD. And there's the mechanisms that I talked about of what it is that creates the brain to begin operating differently, very much involved with what they eat. Okay. Remember I talked about at the beginning, I said you can either be you can do a reactive approach to things, or you can do a proactive approach. Okay. Now, most of our doctors in our society are trained in a reactive approach, meaning you arrive in with a child that has ADHD and you get tested, and yes, it's confirmed you have ADHD. And what is then done is, let's do a medication to alter the brain chemistry in this child's brain. Okay. So 2/3 of them are put on medications as a solution. All I'm saying is I'm trying to wake up everybody to the idea there's more to it than that. And it's certainly not the lack of medications that has caused the child to develop ADHD. So I list one simple thing here, how much even simple dietary fiber and lack of fiber in our diet is one of the reasons why there's more cognitive decline. You know, fiber is the most important thing that's needed to keep your probiotics healthy, okay? To keep that gut healthy. Only 3% of the US population today, 3% meet their daily minimum requirement for fiber, okay? So 97% of us do not meet, well, I think I'm in 3%. 97% of us basically do not meet the minimum requirement for fiber, okay? So this is a whole lecture just talking about ADHD and children and all of that. So I think that you can begin to get the idea that being proactive, being like you begin to think of what's creating these issues with not only your brain, but also the brain of your children and people around you, is that there are things that you do to your body that essentially turn on all these brain problems. So I'm going to begin wrapping up. What I wanted to do is just talk about one or two last things, and to give you some things that you should think with in trying to, like, how do you take this information and work with it. One is that you need to try to create a healthy microbiome because it dictates whether you're going to have inflammation of the brain or not, right? And there are healthy foods that you can eat. Fiber, prebiotics are a type of food. They are fermented types of foods, for example, like kombucha is considered a prebiotic. Things that help with providing food. Prebiotics are basically the food that the healthy bacteria live on. So prebiotics and fiber are the things that your healthy bacteria live on. Then reducing your inflammatory activity. We talked about the things that create inflammation because they are what turn on things like Parkinson's and Alzheimer's and that type of thing. The third thing would be to try, if you have a chronic digestive problem / brain problem, then you should try to identify what are the things that are pounding away at your digestive tract. Some of the things you may know. In fact, I have people coming in and say, sugar doesn't pass my lips. I eat organic. I do everything perfect. I'm mostly plant-based. I'm doing the perfect diet, and I still have digestive problems. So there are other things that can cause digestive problems, such as unknown infections, unknown reactions to foods. Person says, well, I eat only organic whole grain bread. Well, what if you're allergic to gluten, right? Or what if you're sensitive to some other food? This is beating up on the lining of your gut. There are ways of finding these things out. Number 5 there, hormonal balance and stress hormones. What I can tell you is that also one of the things that increases permeability or makes your leaky gut is stress. This has been proven for many years. They've been able to measure permeability of gut before and after major stressful events. And in a matter of moments, you can basically create excess permeability, let alone the person that's under strong excessive stress, they will have a leakier gut, leading to more inflammation in the in the bloodstream, leading to more problems in the brain. Okay. So I want to kind of end up with this. A little bit what I was talking about is you can use labs to start answering some of those questions, those things I listed as to what you could look for. We're going to do that. And then what I want to end off with is I want to kind of wrap up, and then I want to just show you a little bit. By the way, any of you that have questions, please drop them into the chat box. We'll try to answer them. Any of you that have gotten into this lecture a little bit, listened to me, got the intention of my lecture. My intention of the lecture was to have you start thinking about how to take better care of yourself, or have you start thinking about how can I change what I'm doing to my body, okay, in order to change my health, rather than manipulate with medications once my health fails. So hopefully this information has been good for you. So I want to close with one final thing, and that is that if any of you would like to have an opportunity to find out whether we can help you in our clinic as a part of doing these. I've been doing lectures for Dr. Speakers Network for 25 years, and there's always somebody who wants to reach out and find out whether they can be helped, and that's our purpose. So if you feel like you want to have help with your personal health problem or your child's or whatever, please take advantage of our gift. Our gift is a complimentary consultation with one of our clinic directors. It takes about 20 to 30 minutes. You sit down, we go over your health in detail. We give you the perspective of treating your health condition from a root cause standpoint, or more importantly, try to figure out what the root cause of your problem really is. You got a little bit of a taste of it today, that we approach things like anxiety and brain fog and dementia, and we treat people with Alzheimer's, we treat people with all types of ADHD and that type of thing. We're looking, but the way we treat them is by trying to get their body healthier and evaluate what it is that's causing it. If you're interested in that, please take advantage of this. What you need to do is, in your chat box, you need to drop in your phone number or and/or your name, and we will get in contact with you. The other thing that's going to happen is shortly after this video is done, we send you a quick 3 question survey, and that's another way for you to contact us and indicate that you would like to take advantage of the offer. Again, the offer is, we're here to help you. I advise you, if you have a health problem, you should take advantage of it. This is how people find out a new way to take care of themselves. So I hope you all stay safe. Most of you, I think, are probably at home working today. I hope this has been good information for you. I appreciate your attention, and I hope that if you need anything in the future, please let us know. Thank you. Bye-bye.
Oh, copy to the slides.
I think I'm still on. If you, we're going to arrange to get you a copy of the slides as well, because I know I went through them quickly. These are slides I used to be able to give an hour talk in your company, and so we've trimmed it down to about 25 or 30 minutes on a webinar. So I admit that I have gone through some slides that have some important data. So you can definitely get those slides if you, we will actually just give you a link on that survey that we're going to send you. We'll make sure you have a link that you can get those slides, okay? Again, thank you very much. Have a good rest of the day. Thank you.